Are you planning to get pregnant this December? December is a month where there's family reunion, couples tend to get together, those who are having a distant relationship, this is when they come together. So, how can you prepare yourself for pregnancy? This is what we're going to be talking about today. And remember, September babies were conceived in December, and that is why September has the highest number of deliveries. So, if you want to check with statistics, you see that many people have their birthdays in September, and this is why it occurs because conception usually occurs in December. This is Talk Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women related health contents. If these are the kind of content you like to watch, don't forget to click on that subscription button. Let's dive right in. According to the Center of Disease Control and Prevention, they estimated that July till October is the month that has the highest number of deliveries. That's many people tend to have their birthdays within July to October. So we see here that September is an average. So most birthdays are in September. And we said September babies were conceived in December. Now, what is the first thing you need to know? If you're preparing to get pregnant in December, any woman before you're thinking of getting pregnant, I mean before getting pregnant, not when you are already pregnant. Now, the first thing is to know your fertile days. That's you have to have a mastery of your menstrual cycle, know when is your fertile days, most important, your ovulation day. You need to know it. And I've made a lot of videos concerning that, the simplest method to calculate your ovulation day. So you can just click on it here on this link, and after this you can watch it and know how to calculate your ovulation day. That is the first thing. Those who have distant relationship, imagine if the man is coming and you don't know when is your fertile period. I mean, pregnancy can never occur, especially if you, because with that you need to see how you can time it to make sure he comes during the period of your fertile days, because most of the times they come and it's 2 weeks, 3 weeks, or 1 month. So at least make sure that he's coming to during that period. One thing is you need to be placed on some vitamins. We place women on vitamins at least 3 months even before they are thinking to get pregnant. It is given during the pre-conception care. This is what we talk about, pre-conception care. Pre-conception care is something which is not really practiced in our setting. So it's very important. If you want to get pregnant in December, visit the hospital for a pre-conception counseling. During the pre-conception counseling, what is being tested? You're being tested for infections, for example, sexually transmitted infections, which if it's present, it is being treated immediately, because in the long run it can lead to infertility. If you have any chronic infection like hypertension, diabetes, epilepsy, all these kind of maybe chronic diseases, you need to visit your healthcare professional. And this, there are some medications which, for diabetes, there are some medications which you should not take while pregnant. So they switch the medications during the preconception care. Hypertension, there are some ones which you should not take. Epilepsy, so all these things. Sickle cell, maybe you might be taking some medications to manage some complications in sickle cell. So all these things, once you want to start getting pregnant, you have to go for preconception care, and everything is being checked to make sure that you are fine and ready for conception. The second thing during that time, most important, is the vitamins which you'll be given. That's the prenatal vitamins, which contains folic acid, most important. And folic acid, what does it help? It helps to prevent neural tube defects. Neural tube defects, what are they? Neural tube, that's the part of the body that forms the brain and the spinal cord. So, and before you even want to think that you are pregnant, before you're doing a pregnancy test, I'm telling you that these neural tubes have already been formed. So it is not when you are 1 month pregnant, 2 months, or 3 months pregnant that you start taking the folic acid. it's not going to help because the neural tube has already formed, and if there was a defect, it is already there. So you need to start taking it now if you're preparing to get pregnant this December. So during that period, if you're also placed on family planning, you have to remove it and counsel you on the site on some effect if pregnancy has to delay for how long, or if pregnancy just has to come immediately. So you're going to be counseled on all these birth control methods which has been removed from you. So it's very important. So it prepares you even psychologically. You are being counseled. Sometimes once you are prepared for pregnancy, it gives a different feeling. So it's very important you go for pre-conception. Another point is healthy eating. You need to eat healthy, eat a lot of fruits, vegetables, a lot of water. So this is going to, because normally most of these vitamins even that are needed during pregnancy are all in foodstuffs, are all in fruits, are all in vegetables. So if you consume enough, it's also going to help you, help your body prepare for pregnancy. The next, to maintain a good weight. If you're obese, you can even try and start doing some certain exercises. Do light exercises at least 30 minutes. If you do 30 minutes 4 times in a week, I think that's okay for you to gain back your weight. So obesity, it comes with a lot of complications too during pregnancy. Maybe the baby might be big, we start having difficulties in delivery, and it can even expose you to what we call gestational diabetes. So once you start preparing yourself for that, you prepare yourself in the long run to prevent some complications which might occur during pregnancy. And no alcohol, no smoking. This one is very important, and we need to take note. What we need to take note is that women, as you age above 30 years, the rate of you getting pregnant decreases. Getting pregnant during the first trial, it tends to start decreasing. At 35 it decreases, at 40 it drastically decreases. So, and as it's decreasing, means that the number of eggs that are in the ovaries are also reducing. The number of quality eggs that are in the ovaries are also reducing because you have been exposed to chemicals, to some infections which might have destroyed some of the eggs. So you see here that you're more predisposed to having children with congenital malformations. So it's very important that you take these vitamins before getting pregnant. No alcohol. Alcohol too causes, sometimes it causes alcohol, smoking, it causes early miscarriages. You see, you get pregnant 2 months, 3 months, you see that you start bleeding and you miscarriage this baby. So this alcohol, this smoking, please, if you can avoid it, avoid it. I'm not saying reduce, no, I'm saying avoid totally. If you can avoid it, that will be fine for you. After pregnancy, if you still want to drink, you can take it, but within this time, especially women above 30, 35, 40, you want to get pregnant, please avoid taking alcohol and no smoking. Point to note, this is done before getting pregnant, not when you are pregnant and you come to the hospital and you start asking doctor, what can I do? So if this was helpful, you can give a thumbs up to our video, and if you want to have a private discussion with me, you can click on the link on the description box and you get to me and let's consult. Thank you very much and God bless you. Don't forget to click on the subscription button and share the videos.